हेलो फ्रेंड्स, वेलकम बैक टू माय यूट्यूब चैनल कॉन्सेप्ट नर्सिंग क्लासेस। आज की क्लास में आरआरबी नर्सिंग सुपरिंटेंडेंट एग्जाम स्पेशल प्रैक्टिस टेस्ट नंबर 243 सॉल्व करेंगे। क्वेश्चन नंबर 1, यू आर द नर्स वर्किंग विद एन एल्डरली competent client who refuses vitamin B injection ordered by the physician. The family insists that the injection is to be given and you administer it while the client is objecting. Even though the client improves, the client contacts a lawyer. From your knowledge of nursing and the law, you realize that did the right thing because the client improved. We have committed an act of battery against the client. C. Have committed an assault against the client. D. Should have had the family put their request in writing. Correct answer is option B. Have committed an act of battery against the client. जब भी कोई नर्स बिना पेशेंट के कंसेंट के उसको टच करे या उसको कोई भी दवा दे, इंजेक्शन दे, तो इसको बैटरी कहा जाता है। ये पनिशेबल ऑफेंस है, इसलिए यहाँ पर बी ऑप्शन करेक्ट है। हैव कमिटेड एन एक्ट ऑफ बैटरी अगेंस्ट द क्लाइंट। Administering a medical treatment to a competent patient without their consent constitutes battery regardless of the family wishes or the outcome. फैमिली परिवार का यदि कोई सदस्य भी कहे तो भी ऐसा नहीं करना चाहिए। पेशेंट की बिना कंसेंट के उसको इंजेक्शन नहीं देना है। यदि इंजेक्शन दिया जा रहा है पेशेंट के बिना कंजे विदाउट कंसेंट के, तो इट इज कॉल्ड बैटरी। नेक्स्ट क्वेश्चन, non-burn dry thermal disinfection in which waste is shredded and heated in rotating auger is inertization, pyrolytic incineration, microwave radiation, screw feed technology. करेक्ट आंसर होगा इसका ऑप्शन डी, स्क्रू फीड टेक्नोलॉजी। Screw feed technology involves shredding waste and heating it in a rotating auger, effectively disinfecting without combustion. Next question. When assessing a client's hair for pediculosis capitis, which of the following signs will you most likely found? Option A, oval particles looking like dandruff on the hairs. B, crusts on the scalp, especially at the hairline. C, brown or black thread-like lesions. D, small insects with red legs. Correct answer is option A, oval particles looking like dandruff on the hairs. Pediculosis, capitis or head lice infestation is characterized by the presence of nits, lice eggs attached to hair shafts appearing as oval dandruff-like particles. Next question. Klüver-Bucy syndrome is characterized by all except option A, visual agnosia, B, hypersexuality, C, hyperorality, option D, fear. Correct answer is option D, fear. Klüver-Bucy syndrome includes symptoms like visual agnosia, hypersexuality, and hyperorality, but it is associated with a lack of fear, not an increase. यहाँ पर क्लूवर क्लूवर-बुसी सिंड्रोम के बारे में लक्षणों के संबंध में क्वेश्चन पूछा गया है। इसके जो सिम्टम्स होते हैं, विजुअल एग्नोसिया, हाइपरसेक्सुअलिटी एंड हाइपररोरलिटी, ये सिम्टम्स होते हैं, जबकि जो फियर ऑफ लैक है इसमें कमी होती है, इंक्रीज फियर नहीं होता है, इसलिए यहाँ पर डी ऑप्शन। बिटवीन द लोअर बॉर्डर ऑफ द सिम्फाइसिस प्यूबिस टू द मिड पॉइंट इन द सैक्रल प्रोमोन्टरी इज ऑप्शन ए एनाटॉमिकल कॉन्जुगेट, बी ऑब्स्टेट्रिक कॉन्जुगेट, सी ट्रू कॉन्जुगेट, डी डायगोनल कॉन्जुगेट। करेक्ट आंसर इज ऑप्शन डी diagonal conjugate. The diagonal conjugate measures the distance from the lower border of the symphysis pubis to the sacral promontory, important in assessing pelvic size for childbirth. Next question. Sudden intense mid-epigastric pain radiating to the right shoulder may indicate option A strangulated hernia, B GERD, C gastric outlet obstruction, D ulcer perforation. Correct answer is option D, that is ulcer perforation. मिड एपिगैस्ट्रिक पेन के संबंध में क्वेश्चन यहाँ पर पूछा गया है। तो ऐसा सडन इंटेंस मिड एपिगैस्ट्रिक पेन होता है जो कि राइट शोल्डर तक जा सकता है, तो उसको रेडिएट करता है दाएं कंधे तक। तो इस प्रकार का जो पेन होता है ये इंडिकेट किसको कर रहा है? यह कर रहा है अल्सर परफोरेशन को। सो द करेक्ट आंसर इज ऑप्शन डी। Perforation of a peptic ulcer can cause severe mid-epigastric pain that radiates to the right shoulder due to the irritation of the diaphragm. Next question. When weighing a client daily, it is most important to weigh the client when most rested, B at the same time each day, C after the shower or bath, D when higher priorities are completed. Correct answer is option B at the same time each day. Weighing the client at the same time daily ensures consistency and accuracy in monitoring weight changes. Next question. Blood clotting time is considerably prolonged in deficiency of vitamin B2, vitamin B3, vitamin K, vitamin B6. Correct answer is option D, vitamin B6. Vitamin K is essential for synthesizing clotting factors. Its deficiency leads to prolonged clotting time. Next question. The process of tightening the fibrin clot to decrease the hemorrhage is called A. Fibrositis, B. Fibrinolysis, C. Synarthrosis, D. Syneresis. Correct answer is option D, syneresis. The process of tightening the fibrin clot in such a way that the ruptured area of the blood vessel gets smaller and smaller, thus decreasing the hemorrhage, it is called syneresis. Next question. Which vitamin is essential for blood clotting? Vitamin A, vitamin C, vitamin K, vitamin D. Correct answer is option C, vitamin K is essential for blood clotting. Vitamin K plays a crucial role in synthesizing clotting factors which are essential for blood coagulation. A deficiency in vitamin K lead to bleeding disorders. Next question. The normal range of hemoglobin for adult females is option A 12 to 16 gram per dl, B 14 to 18 gram per dl, C 10 to 14 gram per dl, D 16 to 20 gram per dl. Correct answer is option A 12 to 16 gram per dl is the normal range of hemoglobin for adult females. The typical hemoglobin range for adult females is between 12 to 16 grams per dl. Levels below this range may indicate anemia. Next question. Which electrolyte imbalance is commonly associated with muscle weakness? A. Hyperkalemia, B. Hypokalemia, C. Hypernatremia, D. Hyponatremia. Correct answer is option B. Hypokalemia is commonly associated with muscle weakness. Hypokalemia or low potassium levels can lead to muscle weakness, cramps, and fatigue due to its role in muscle contraction and nerve function. Next question. The primary purpose of a community health assessment is to option A. Diagnose individual patients, B. Identify community health needs, C. Provide direct patient care, D. Manage hospital resources. And the correct answer is option B. Identify community health needs. A community health assessment aims to collect and analyze data to understand the health needs and resources of a community, guiding public health interventions and policy decisions. Next question. Which of the following is a live attenuated vaccine? A. Hepatitis B vaccine, B. Measles, mumps and rubella vaccine, C. Inactivated polio vaccine, D. Tetanus toxoid. And the correct answer is option B. Measles, mumps and rubella, that is called MMR vaccine, is live attenuated vaccine. The MMR vaccine contains live attenuated viruses which are weakened forms of the viruses that stimulate an immune response without causing the disease. Next question. The incubation period of hepatitis A is typically 2 to 6 days, 7 to 14 days, 15 to 50 days, 60 to 90 days. And the correct answer is option C. 15 to 50 days is the correct incubation period of hepatitis A. Hepatitis A has an incubation period ranging from 15 to 50 days, during which the virus replicates before symptoms appear. Next question. Which method is most effective for sterilizing surgical instruments? Vialing, autoclaving, chemical disinfection, ultraviolet radiation. And the correct answer is option B. Autoclaving is most effective for sterilizing surgical instruments. Autoclaving uses pressurized steam to achieve high temperatures, effectively killing all microorganisms, including spores, making it the preferred method for sterilizing surgical instruments. Next question. The most common cause of maternal mortality in India is option A, hemorrhage, B, infection, C, hypertensive disorders, D, obstructive labor. And the correct answer is option A, hemorrhage. Postpartum hemorrhage or PPS is the leading cause of maternal mortality in India, often due to inadequate access to timely and appropriate medical care. Next question. Which of the following is a waterborne disease? Option A, tuberculosis, B, cholera, C, measles, D, influenza. And the correct answer is option B, cholera is a waterborne disease. Cholera is caused by the bacterium Vibrio cholerae, which is transmitted through contaminated water, leading to severe diarrhea and dehydration. Next question. The term cold chain in immunization refers to option A network of healthcare providers, B, a series of refrigerated storage and transport procedures, C, a method of tracking vaccine distribution, D, a type of vaccine preservative. And the correct answer is option B, cold chain in immunization refers to a series of refrigerated storage and transport procedures. Next question. Which of the following is the most common cause of maternal mortality in India? Hemorrhage, sepsis, obstructive labor, hypertensive disorder. And the correct answer is option A, hemorrhage. Next question. The Integrated Child Development Services ICDS scheme in India aims to improve the health and nutrition of A, adolescent, B, pregnant and lactating mothers, C, children under 6 years, D, all of the above. And the correct answer is ICDS in India aims to improve the all of the above conditions: adolescent, pregnant and lactating mothers, and children under 6 years. The ICDS scheme provides food, preschool education, and primary health care to children under 6 years as well as to pregnant and lactating mothers and adolescents. Next question. The Janani Suraksha Yojana JSY is a safe motherhood program under the National Health Mission NHM that promotes A, institutional deliveries, B, home birth, C, traditional birth practices, D, none of the above. And the correct answer is option A, institutional deliveries. JSY incentivizes pregnant women to opt for institutional deliveries to reduce maternal and neonatal mortality. Next question. Which of the following disease is not covered under the Universal Immunization Program UIP in India? A, polio, B, measles, C, hepatitis, D. Malaria. Correct answer is option D. Malaria is not included in universal immunization program. The UIP includes vaccines for diseases like polio, measles, and hepatitis B, but malaria prevention relies on vector control and chemoprophylaxis, not vaccination. Next question. In the context of public health, the term daily stands for A. Daily adjusted life years. B. Disability adjusted life years. C. Disease associated life years. D. Death adjusted life years. And the correct answer is option B. Disability adjusted life years. Daily is a measure used to assess the overall disease burden expressed as the number of years lost due to ill health, disability, or early death. Next question. Which component is not part of the primary healthcare approach as outlined in the Almata Declaration? Option A. Community participation. B. Equitable distribution. C. Use of appropriate technology. D. Specialized hospital care. And the correct answer is option D. Specialized hospital care is not part of the primary healthcare approach. The Almata Declaration emphasizes primary healthcare components like community participation, equitable distribution, and appropriate technology rather than specialized hospital care. Next question. The राष्ट्रीय बाल स्वास्थ्य कार्यक्रम RBSK aims to screen children for A. Defects at birth, B. Diseases, C. Deficiencies, D. Developmental delays, and the correct answer is all of the above. RBSK is a national program aimed at early identification and intervention for children from birth to 18 years to cover defects at birth, diseases, deficiencies, and developmental delays. Next question. The National Health Mission (NHM) was launched in which year? A. 2005, B. 2013, C. 2017, D. 2019. Correct answer is option B. 2013. The NHM was launched in 2013, subsuming the National Rural Health Mission (NRHM) and the National Urban Health Mission (NUHM) to provide universal access to equitable, affordable, and quality health services. Next question. The Kaya Kalp initiative by the Ministry of Health and Family Welfare aims to option A. Improve hospital cleanliness and hygiene. B. Provide free medicines. C. Enhance medical education. D. Promote traditional medicine. Correct answer is Option A. Improve hospital cleanliness and hygiene. Kayakalp awards public health facilities for their efforts to promote cleanliness, hygiene and infection control. Next question. Which of the following is a vector-borne disease? A. Tuberculosis, B. Dengue, C. HIV/AIDS, D. Leprosy. And the correct answer is option B. Dengue is a vector-borne disease. Dengue is transmitted by Aedes mosquitoes, making it a vector-borne disease. नेक्स्ट एंड लास्ट क्वेश्चन, प्रसव के दौरान होने वाले मूवमेंट्स का सही क्रम है। द करेक्ट ऑर्डर एट द टाइम ऑफ लेबर इज ए engagement, flexion, internal rotation, descent, B engagement, internal rotation, restitution, crowning, C engagement, descent, flexion, internal rotation, D engagement, restitution, flexion, internal rotation. And the correct answer is option C engagement, descent, flexion and internal rotation.